Welcome to the myth-busting zone. When it comes to Medicare, there's more folklore out there than in an episode of Ancient Aliens. It's time to separate fact from fiction, reality from rumor, and get down to the nitty-gritty of what Medicare really is and isn't. Let's dive into some of the most common Medicare myths and send them packing. Myth 1. Medicare is free. Free as a bird, right? Wrong, let's clear the air. Medicare isn't a free-for-all. Part A, which covers hospital visits, usually doesn't have a premium if you've worked and paid Medicare taxes for a certain amount of time. But it's not entirely cost-free. There are deductibles and copays. And let's not forget about Part B, medical insurance, and Part D, prescription drug coverage. They definitely have premiums. Myth 2. Medicare covers everything. Think Medicare is the magical umbrella that covers all your health needs? Think again. It covers a lot, but it's not a catch-all. Long-term care? Nope. Dental, vision, and hearing aids? Nada, unless you opt for certain Medicare Advantage plans. It's important to understand the gaps so you don't get caught in the rain without an umbrella. Myth 3. You're automatically enrolled at 65. Just because you hit the big 6, 5 doesn't mean you're automatically in the club. If you're already receiving Social Security benefits, then yes, you'll be auto-enrolled in Parts A and B. But if not, mark your calendar. You have a 7-month enrollment window starting 3 months before your 65th birthday month. Miss this window, and you could be paying penalties. Myth 4. Medicare is only for the elderly. Sure, 65 is the magic number, but Medicare isn't exclusively a seniors-only club. Younger individuals with certain disabilities or end-stage renal disease, ESRD, can also get Medicare benefits. So it's not just your grandpa's healthcare plan. Myth 5. All Medicare plans are the same thinking. All Medicare plans are cut from the same cloth. Time for a reality check. Original Medicare, Parts A and B, is just the beginning. There are Medicare Advantage plans, Part C, prescription drug plans, Part D, and Medigap policies, all with different coverage, costs, and rules. One size does not fit all here. Myth 6. You can't switch plans once you choose locked in forever. Nope. During certain times of the year, like the annual enrollment period, you can switch up your Medicare Advantage or Part D plans. And if you've got original Medicare, you can decide to jump ship to Medicare Advantage and vice versa. So you're not stuck with your initial choice for eternity. By busting these myths, we're not just setting the record straight, we're empowering you to make informed decisions about your healthcare. Medicare might seem like a labyrinth at first glance, but with a little myth busting, it's easier to navigate than you think. Armed with facts, your journey through Medicare can be a lot less daunting.